not very often, but every once in a while, we get to interview a CEO of a publicly traded company. And what's interesting about this company, by the way, medicalmarijuanainc.com is their website. The name of the company, Medical Marijuana Inc., as the website would say, and their stock symbol MJNA. And joining us today, Stewart Titus. Stewart, thanks for stopping by the studio today. It's great to have you in studio.
Great to be here. Thank you so much.
So,
Our company first became public in March of 2009. I was one of the original investors. I think I was the number 7 investor in the company. And the space that we're involved with, of course, it borders on this quasi-legal market where, Colorado now we have, and also in Washington, recreational marijuana that's being sold on the marketplace. But we don't really touch any controlled substances.
So this is not that.
This is not that. This is more the industrial hemp or the healthy side. We like to say it's healthy, not high.
Okay, very good. Okay, which I think which is a difference, because obviously there's when you invested in this, and let's go back there as an investor. That's a battle when you're sort of saying to yourself, okay, here's a company who probably has a great market size to deal with. It's got a good business model, but it's going to have some pushback from some people because they're going to think marijuana, controlled substance versus hemp are the same thing.
Right. Exactly.
So that's a narrative you guys have to probably constantly battle, or you've had to figure out in your marketing side.
Absolutely. It's been a real challenge, but we're making progress every day.
I bet.
This is sort of history making, because this is the first publicly traded company that's in the cannabis business. Talk about that a little bit.
Yes. Well, we really like to think of ourselves as the granddaddy of this industry. Since we became public, there are about 250 other companies that have followed us and have come along into the public space with one business model or another. And we're a very diversified company, so we have multiple interests.
Stewart Titus is our guest today. He's the CEO of Medical Marijuana Inc. MJNA is their stock symbol. And I can't remember who found you. I think maybe a listener or viewer told us about you guys. But so talk about what you do. So now that we sort of know what the business is about, we sort of know how it started. What do you exactly? What exactly do you guys do? Do you guys do development? Do you do nutraceutical, or are you an end sort of a B2C sort of business where you're just selling products?
Well, we have a number of businesses, and of course, our marketing and sales division are, of course, something that people really recognize us for. We had the first CBD, hemp-based CBD products on the marketplace.
What is CBD?
CBD is an extract from the industrial hemp plant, or it can also be extracted from marijuana, if you will. But it's one of the many cannabinoids, as they're called, and there are over 80 of these cannabinoids. People are very familiar with the THC in marijuana. That's what gets you high.
That's what makes you giggle a little.
It does a little bit.
Does
Makes
your
you buy
body,
a box of Pringles, right?
You're out there, you
that's
got
a whole
orange
different deal.
fingertips. Guess what? Cheetos were in your life.
All right, so that's the THC. CBD is something different.
It is. It's on the other side, and it's really something that helps you to relax. There's been tremendous study and research on the benefits of CBD.
Benefits all over. Epileptic seizures, PTSD, actually increases your lung capacity in some situations. It's an amazing group of chemicals in the marijuana plant.
That's for sure.
And finding the right ones is legal, I would imagine. Now you're saying CBDs. So what about sending this to my aunt in New York? Am I breaking the law by sticking this in the mail?
No, it's derived from industrial hemp, and since it's from hemp, and hemp products are legal here in the U.S., you go to the health food store, you see hemp oil, and you
hemp
have
seeds,
your protein powders and
milk.
the like. Yes, so those products are legal, and we really fit in that same category.
You know, it's interesting, and I've said this before on my talk show in San Diego and L.A. too, and that is that marijuana is the most recreationally used drug in the country, and it makes criminals out of makes would-be criminals out of otherwise law-abiding citizens. And what's interesting here is that I think that the hemp industry in the last 10 years has done a great job of going from point A to point B, but specifically in the last probably 2 years has people are figuring out that it's not the same thing, and I think that was one of the biggest challenges. We're going to take you over the breaks. Dr. Stewart Titus is with us. He's the CEO of Medical Marijuana Inc. MJNA is the stock symbol.
Wow.
MedicalMarijuanaInc.com. We're going to take you through some of the products when we come back from the break, and some of the benefits of some of the things that they sell.
Yep.
And
I got it from here, Bob. I think we're good.
Thank you, Russ. Big Biz Show, BigBizShow.com. Stand by. It's like Christmas for Rusty Nails over there. There you go.
Look at that.
Look at all that stuff. You got hemp oil, you got Canactive, you got the hemp vape, you've got the Canna Kick, all that stuff there. Of course, you're looking at, if you're just joining us on television, you're taking a look at some of the products of Medical Marijuana Inc. They can be found at MedicalMarijuanaInc.com. If you're listening to us on the radio, just go to the website, BigBizShow.com. We'll have all these links there for you if you can't remember by the time you get home. But Stewart Titus, Dr. Stewart Titus is the CEO of the company. And, of course, their stock symbol, MJNA. Yeah, they're publicly traded. Interesting stuff. And I will tell you, we've been talking about hemp versus marijuana and THC versus CBD.
Right.
But what's really interesting is you're not just a products company. You're also a biotech company, which is interesting because here, and even though you might be watching us in Opelika, Alabama, or listening to us in a far-off land on American Forces Radio Network, or even in a far-off land like Minneapolis, San Diego is one of the biggest market drivers in San Diego is biotech. And long story short, you have a biotech background, and you guys are a biotech company. Talk about that a little bit.
Well, yes. Medical Marijuana Inc. does have a nice ownership interest in a company called Canalife Sciences. And Canalife is developing pharmaceutical compounds based on the U.S. government's patent on the therapeutic use of these cannabinoids.
Mm-hmm. So that's really there's a sliver open in the door there, and you guys are taking advantage of that because all of a sudden the government, the FDA, is saying, hey, wait a minute, there might be something to this. And like we've had other guests on the air, all medicine used to come from plants at one point before we synthesize medicine, right?
Right.
And then, of course, now you have a nutraceuticals business and you've got a pharmaceuticals business. This would fall under consumer services, but the Canalife is kind of creeping into the nutraceuticals or pharmaceuticals business.
Pharmaceuticals.
No
actually,
kidding.
yes.
That's big news, isn't it?
It really is. And they have a license agreement with the National Institutes of Health to develop a couple of pharmaceutical compounds based on CBD and these other cannabinoids.
So are there any sort of specific outcomes they're looking for, like one that'll calm people down or anxiety drugs, or what are they looking to develop?
Well, we have two indications from the NIH. The first one is to treat a condition technically called hepatic encephalopathy. You and I might call it alcoholism.
Okay.
It's just a liver-brain disorder.
Or the rusty nails disease. Perfect.
No.
Yeah, that's right. That's so it can help cure that.
Well, we would like to believe
Or
that this
treat
will be
it.
a very strong neuroprotectant. So it will help protect your liver, protect your brain
No
from some of the
kidding.
onslaught from these unfortunate chemicals.
And
if
NIH,
drinking
by the
is
way.
your poison, you might segue over to an occasional hit and not drink as much.
Is that the idea? I don't think that's the idea. I think the idea behind it is that this is a pharmaceutical answer to alcoholism, possibly.
Very possibly,
Right.
yes. And we're still working on our clinical development. We've been through preclinicals. We're now in animal testing phase. And
Let's talk about the National Institute of Health and talk about the FDA. How navigating through those waters, we hear Johnny Lunchbucket. Our eyes roll back in our head, and we're thinking that is a 10-year process. Is it different when you have a cutting edge or something disruptive like this? Because this is, by definition, disruptive.
it can be, but our indication initially is for what's called an orphan drug. So it may take a 10-year process, bring it down to between 4 and 6. It's still going to require significant study and all the rigorous research that the FDA requires, but we're looking forward to the challenge and moving forward.
And there's plenty of gold in them our hills too. Each time you get further into a different chemical portion of marijuana,
Yeah,
you go, wait, this one could help this.
Certainly that's what we're finding. And our second indication is for traumatic brain injury, or CTE, which is now very prevalent among the NFL football players. And recently, Dr. Bennett Amalu has come on to our scientific advisory board, and he was the pathologist who really discovered this CTE in the NFL football players.
You know, so what we're talking about here is if these drugs were to come out and if these drugs were to be successful, and obviously there's a road to go down to do that, though. Is this, and I may be even asking this too early, you may not even know this yet, but is this something where NFL players would be taking this while they play in order to combat this in the future, or is this a treatment issue?
Very, very possibly both. We definitely like to think that this would be potentially an answer for some of the unfortunate late effects that these players suffer when their careers are over and they're trying to be normal in society. And unfortunately, they just have situations. A lot of them just lose the sight of where they are in the world. They're a little disoriented, or dizzy, or their speech. They can't complete a full sentence.
Yeah. I've been there.
Yeah, sure you have. It has nothing to do with football either.
No.
Of course, talking to Stewart Titus, Dr. Stewart Titus, the CEO of Medical Marijuana Inc. MJNA is the stock symbol. And of course, medicalmarijuanainc.com is their website. Let's talk about some of these products that are in front of Rusty Nails. One thing I see here, and it's been in the news a lot, is vaping. And I see something there called hemp vape. Talk about that, because obviously people are going to start thinking, well, am I smoking marijuana now? Let's once again say, no, you're not smoking marijuana. Talk about what that does.
Right. So the hemp vape is a nice product. It's a hemp oil-based product that you can vaporize. It's been something that I find to be quite relaxing. That's the piece that would charge in and replug.
And that's what I'm saying. If you're having a cocktail after work to relax, you might skip that cocktail as your
CBD instead.
Well,
all right, okay. I can. So the hemp vape is it's like a vape, like in the industry we've been talking about vaping, so to speak.
Right. Yes.
And that's that's one of the products you guys sell at medicalmarijuanainc.com. Talk to us also. I see this Canna Kick thing. What is? There's a red box and there's an orange box. What's Canna Kick?
Sure.
No, the little ones.
Oh, the little guys.
The small ones.
I just ate one, so maybe I should have asked first.
Yeah. What is that? Is that like an energy drink sort of thing?
It is. It's like an energy drink, chewable. So you don't have the liquid. Say, for example, if you're on an airplane or something, and you want to have a little boost for, you're coming down for landing, you have a big meeting or something, you might want to take a
and they're divided up.
But this is not. These are not mind altering. Let's make that very clear. And I think that's one. And again, that's the narrative you guys have to battle for a little bit until people try to understand. There's a difference between THC, CBD. There is no THC in this. This is like any other nutraceutical, correct?
Exactly. Yes, they don't have the psychoactive benefits.
And doesn't your body already produce something real similar to what you're putting in it with
Your
this?
body normally does. Yes, it's been postulated that the runner's high is actually a release of the natural cannabinoids within the body.
I'm there.
Dr. Stewart Titus, the CEO of Medical Marijuana Inc., stock symbol MJNA, medicalmarijuanainc.com. Will you come back with us? We'd love to have you back.
I would love to, absolutely. I'd love your guys' technical analysis. I worked on Wall Street for many years.
So he's validated me while he's invalidated you.